This video is going to go over some of the miscellaneous special tests that we see for the foot and ankle. There really is not a thematic element to this, as we're going to be looking at things related to possible DVT, as well as syndesmotic sprain, even rupture of the Achilles tendon. So let's start there. And that is our Thompson test. Now, the Thompson test is also called the Simmons test or the Simmons-Thompson test, named for the individuals that identified this pattern. And what it examines is the integrity of the Achilles tendon by squeezing the calf. Now, in this case, we're going to have our client slide down just a little bit on the table so there's no restriction of the range of motion. We should see that the foot and ankle is in a slightly plantar flex position. And if we squeeze the calf, we'll note that the foot moves, right? And the reason for that is the Achilles tendon is intact. So as we squeeze the calf, the foot moves. If the integrity was compromised, the Achilles tendon, essentially this is what we would see. We would squeeze the calf and nothing would occur at the foot and ankle, much like you see here. I'm preventing this, though even as I squeeze the calf, I can feel the tension build and push against me. So a positive test would be no apparent plantar flexion. If it's performed as a clinical test to identify the presence of an Achilles rupture, that's how it would be designed. The next test is what's known as the heel thump test, and this is used to begin to kind of narrow your focus or funnel your focus towards the presence of a tibial stress fracture. Now, stress fractures are notoriously hard to diagnose and are oftentimes a multidisciplinary factor with that, so don't use this in isolation, but the heel thump test is useful for screening and can be performed one of two ways. One, in a prone position where a force is delivered through the heel, and the second would be a heel drop test where the individual actually raises up on their toes and then drops back quickly onto their heels. As you can imagine, if an individual knew or had apprehension that that would hurt, there would be some hesitancy to do that. And so sometimes you as the clinician may favor the heel thump test because it allows you to deliver the force instead of the patient. What this looks like is you're going to be at an angle and you're going to be using your palm to deliver the force very linearly into the Achilles. Now, a positive test would be pain either along the shaft of the tibia that may indicate a stress fracture, or pain in the area of the ankle that indicates potentially a high ankle sprain or a syndesmotic sprain. So what this would look like is this. We obviously want to make sure that the client or patient knows what we're doing so it's not jarring or excitable to them. But what we're going to do is kind of leave this hand out of the equation and just use our right hand. If we contact like this because the foot's in plantar flexion, we're actually going to make contact with our hand as well. And so oftentimes if we just bring our hand to the side, that works a little bit better. And so what it looks like is this. Heel thump test. The next test that we're going to look at, we need the patient in a supine position, and this is what's known as the Kleiger test. So we're going to have our patient flip over onto their back. The Kleiger test is also known as an external rotation stress test, or in your textbook by Raymond, it's called the syndesmosis squeeze test. The patient can either be sitting at the end of the table in a long sitting position or can be supine. At this point, the clinician is going to stabilize the distal tibia fibula, and so that can just be done by providing kind of this anterior to posterior force into the treatment table. From here, you can either grasp the calcaneus or you can grasp the midfoot, dorsiflex, and then provide a degree of external rotation. And so what that would look like is we dorsiflex, and then we're going to take that foot into external rotation. Now, because this individual's syndesmosis is still intact, you can see even as I'm providing this force, the knee and the rest of the leg come along for the ride. An individual who has suffered a high ankle sprain or a syndesmotic sprain, though, is oftentimes going to have increased pain and laxity here, such that you would actually, as you go into this external rotation, be spreading apart the distal tib fib joint due to the fact that the syndesmosis would be disrupted. So again, Kleiger test, also known as the syndesmosis squeeze test in Raymond's text. The next two tests that we're going to talk about are the Tinel's test and the Morton's test. Tinel's, you may remember, is a test that looks at provocation of nerves through an area of potential compression. And so Tinel's test is going to be delivered at the tarsal tunnel. Now in this case, we're going to have the right leg bent back so you can visualize the left leg. The tarsal tunnel is found just posterior to the medial malleolus. The individual can be in a seated or supine position, and from here you're going to tap the posterior tibial nerve in that tarsal tunnel on the medial side. And so the neurovascular structures and the tendons run right through here, posterior to the medial malleolus. You could either tap with your finger, or if you feel that you can do it better with a reflex hammer, you may use that as well. And then you would ask the individual if there's any pain that's radiating or they're receiving any numbness and tingling. That would be the indication of a positive test. Finally, the Morton's test can also be done in this position, either seated or supine. What you're looking to do in this case is to compress the foot by applying pressure at both the medial and the lateral aspects of the foot at the metatarsophalangeal joint. So you're into more of the distal forefoot. You would squeeze like such. A positive test would be sharp pain at the location of what's known as a Morton's neuroma, which is a conglomeration of neurologic structures. Pain then is also worsened by activity or compression. So have a go with those special tests with a peer or a colleague, and let me know if there's any questions.